Hi all, welcome to my office today, and I hope that you are all staying well and that you are in good spirits. And even though they call it social distancing, I like to call it physical distancing because we're still very social. You can still see each other and have events, have gatherings. We're just going to do it a little differently. We're just going to have physical distancing, and you could have a dinner party. You could have a couple get their dinner ready, and then you can have your dinner ready and set up a time and then go live online just as we are at this time. And the other thing, just so you know, is that you can see your doctor live on video. So I see a lot of my patients with the video. So if you're a member, your members already know this. They see me online, and we've been doing this for quite a while. So if you go to my website and actually click on, schedule a test, schedule an appointment, and when you hit that button, there are several different types of appointments, and you can get a virtual appointment with a member or non-member. So if you're a non-member, you can also now have a virtual appointment at this time, which is nice to know, because you don't want to increase your risk of exposure. Though the way that we actually, working in the ER, so I'm still working in the ER, that we actually do to prevent anyone from getting infections, and actually trying to keep the area of infection down in our hospital. Though I think that the nationwide, or what they're going to do, is that have different sites that are going to be focus of where the COVID is. So generally what we do is we're wearing our PPEs, and well, as the general public come in, you will screen them if you've had a cough, fever, shortness of breath. If the answer is no, then you move to, if any travel, been exposed to someone to COVID, or been traveling to that area. If that's all no, and your complaint is a sprained ankle, you get to go into the ER, be evaluated. So the same procedure I do in my office, the same all of that. So if you want to be seen physically, you would have to answer all these questions, and then you could come in. Or I can actually still see you virtually, because I can do that, which I do in telemedicine all the time. I will see a sprained ankle, for example, and I will actually have the patients do the exam. So if this is my foot, then I'd say, push in this area, does that hurt there? Push here, does that hurt? Or move your fingers this, and then we just go through the exam. Things that I cannot do would be to listen to your lungs, to measure a pulse ox. So if you're short of breath, you absolutely need to go in to see someone, because you need to have your lungs listened to. You need to know if your oxygenation is good. So let's say that you answer those questions, that you do have a cough, you have a fever. So then you would not go into the emergency room. You would go into a dirty zone or a yellow zone, or whatever we're going to call it, to that area. And then you will get your vital signs, you get your pulse ox. So let's say your pulse ox was normal, which is your oxygenation in your lungs. And then let's say that, and you listen to the lungs and they're fine. So you have a cough, you had a fever, so you have a virus. We don't, and we certainly can test, and then we will send you home to isolate. So what I'm asking people to do really is that if you have any kind of virus, it doesn't matter what type. What we don't want to do when we have a virus is to spread it and share it, because it can be harmful for those who have a weaker immune system, right? No one is talking about the 55,000 people who have died of the flu as of March 7th. Because the flu, the infectivity rate, or the R0 ratio, is 1-to-1, and the case fatality rate is 0.1%, that wasn't overwhelming our medical services, right? But with this virus, the COVID, the R naught factor is 1 to 3. One person infects 3 people, and then it just explodes. And the case fatality rate is around 3%. So just statistically doing those numbers, that the resources will not be able to accommodate that. So we share our viruses for the flu because we can accommodate that. I think that hopefully that etiquette will change and we'll be more conscious. If we have a virus, we'll isolate. And so when you have a cold and you don't know if it's your allergies or if you're a cold or a virus, try to differentiate. Definitely if you have a fever, you want to stay in a room. You don't want to share cups, things like that. You want to make sure you wash your hands because hands are the vector. That's causing the illnesses, right? Because you can have the COVID and it's going to die eventually on your clothing. But if someone sneezed on you and then you put your hand on it immediately, then you immediately rubbed your eye, nose, mouth, or other private mucosal surfaces, then the virus has entered your body. And once it enters the body, it's looking for, it's ingenious how it's done this, is because our bodies are constantly repairing itself. When you're born, you're getting bombarded by things, and the body is always repairing, always protecting you. You don't have to do anything, and your immune system's working on its own. So it's constantly repairing. And one of these things that helps repair it is you'll have these, what we call ACE2 receptor sites on the cell wall. And why I like to explain that is that when you have a highway, which is pristine, clean, nice, nothing going on, and all of a sudden you have a little blip, a little pothole, and then you've got Caltrans with the cones and the people and the bulldozers and everything on there. So then so now the virus is trying to find a way in, and they're looking for those repair sites. So now this person only has one repair site. You have all these viruses, only one virus can get onto that globon, and the rest pass through, right? And the immune system can actually now fight that one off because it's not overwhelmed. But imagine somebody who has a body that has multiple repairs going on because they have multiple inflammation processes. And so you have Caltrans every half a mile. So now you have the virus entering and they have all these targets that they can hit. So that's why it's key. You want to decrease your inflammation. You want to, which you can do with eating the right foods, exercising, having positive moods, certain things will decrease the inflammation. You can always visit me, see me on telehealth, and we can go through that with you specifically. Or you can, do and explore the practice and see if you want to work with me or not. But that is something that I do, is to look at your body, your makeup, what's going on, that's going to help you to stay healthy, right? So after we test, so let's say that you're the person who has the cough, the fever, and now your oxygenation's not well, right? And you're short of breath, right? So now we're going to send you on through to the next area, and we're going to listen to your lungs, and we're going to maybe, if you were really sick, we look at your lungs with an ultrasound. And if we see concerning signs on the ultrasound before, not even going into the ER, we're going to admit you directly into an ICU. So we were so most hospitals are going to have these hot zones. So I know for Kaiser, they designated one area, one hospital is their COVID hospital. The rest that if they screen them and you don't have any risk factors for it, then they're going to see all the others: broken ankles, you have a heart attack, you're having a stroke. So those we're trying to separate because there's still going to be other medical issues, right? So trying to isolate to that area. Then once you have someone who has maybe shortness of breath but has other reasons, and a cough, and we're not certain if it's COVID, we're going to test, put you into an isolation room, and then continue the workup. So the best thing to do if you have a cold or a virus is just assume that you're positive. Doesn't matter if you get tested, you're positive. Just assume you're positive. Protect yourself by hydrating, vitamin C's, making sure you take vitamin D, vitamin A, you get, get plenty of rest. And if you pass a week, after the week, 7 to 8 days, you're going to recover. Now, if you're concerned and you're feeling short of breath and it's getting within the week, definitely seek attention, because what we're finding is that usually the downturn is right around 7 to 8 days when people are getting quite ill and succumbing to this. So the other things that that I'm hoping that is going to change in our society is that how we treat this virus. I think that how we when we're sick, I think there's a machismo about us here, is that we all want to work, and we will work even when we're ill or injured. Some have to do that because they live paycheck to paycheck. I mean, I see that a lot in the ER. Unfortunately, there's not a good safety net. I hope there's going to be a better safety net for those people, because frequently I'll say that you have a cold, you have a virus, you have whatever, you need a note. I'm writing you a note off work, and they'll say, no, I'm a food server at some fast food place, and I have to go. We're short-handed, or my boss is not going to let me, they're not going to accept this note. So if we could have safety nets and understanding that if you're ill, you shouldn't go in. There are some workforces that give you bonuses if there's no sick days taken. I think that's different than injuries. If you're not taking sick days, so those things need to change. And the other thing is, I saw on the newscaster, she even reported, I normally would come in and share my germs. I could work. I'm not that sick, but because of COVID, I'm doing this from telehealth. But I would have been in, right? I think that it should be opposite. We should be rewarded that, hey, I'm sick. I'm going to work from home remotely today, and we should say, yay, that's good, because we're going to protect all of those people who have weaker immune systems. So if you like my little tidbits that I share with you, and if you're interested in seeing me on telehealth, like this, share this, pass it along. I hope it gave you some tips, and I hope it just alleviates some fears. And even though we're physically distanced, just keep socially connecting. All right? Have a great day.